Okay.
All right?
Okay.
Yes. But you see, because it is very common, it's even done in our home setup by these wanzams. We call them traditional circumcisers.
Yeah.
All right? So people presume or assume that it's a very simple procedure.
It's not?
Yes, not. Because it could be attended with complications.
Mm-hmm.
All right?
Yeah, speaking about complications, I'm reading here that recent 2025 research from the whole teaching hospital showed complications in 12.37% of 186 cases. That's not a good thing, is it?
Talking about whole Volta region, last 2 years, we lost a child from circumcision.
Ooh.
You know what happened? The child was circumcised by a non-health professional, somebody who just saw somebody doing circumcision, and he thought that, wow, I can apply this as my trade, as my source of livelihood. He went ahead to circumcise this child, and the child started bleeding. And once the child was bleeding, because he has not been trained, he didn't advise the child to be brought to the hospital. He kept reassuring the parents it will stop, the bleeding will stop.
It's normal.
It will stop, it will stop. In the middle of the night, the child was weak. The child couldn't cry. By morning, the child died. So you see, people are dying from circumcision.
Oh.
So it is not as simple as people think.
Yeah.
You understand? Every surgical procedure has inherent risks, bleeding, infection, and all those things. So you cannot watch...
And even in this case, death.
Yeah, and death, yes. So you cannot watch a procedure by somebody doing it or on YouTube or Instagram and think that, oh, this is a very simple procedure, I can go ahead and do it.
Yeah.
All right? I have seen cases where the penis itself have been amputated, have been cut off.
Yeah.
You could see some of the pictures I brought. The pictures cut off because the person doing the circumcision doesn't know how to do it. Sometimes, in the heat of things, whilst the patient is bleeding, they will tie a very big knot. Yeah. Last year, for instance, I had a case like that where I think the child was bleeding and the person put a nylon tube, that's a big suture, tied the artery. So when the child came 2 days, 3 days later, the head of the penis was almost off, was dead.
And the whole life is just destroyed.
Because these things are normally done in the home setting. So once there's bleeding, it's like now they just grab anything they get just to secure the bleeding. And some of them are being done by people who are not well trained. So they don't bring the case to the hospital. They are afraid that they'll be chastised or they'll be blamed and all those things. So we keep on reassuring them until it gets worse. All right? So that's why we are coming out to talk about these things. You know, that get proper education, training before you attempt circumcision. Don't think it's that simple. You understand?
Because amputation and I see here urethral cutaneous fistula were noted in the studies from the
Yes. Usually what is that? There's an artery just below the penis. It's called frenulum artery. Okay. You see, and that's the artery that usually bleeds during circumcision. So in the heat of things, you want to catch it and tie it to stop the bleeding. But doing that, you are strangulating the tissues, so there's no blood flow to that side. So they will create a hole there. So when a child is urinating, it has 2 holes, one from the real penis and another one from where the blood, the skin has been depleted of its blood supply. And sometimes performing these surgeries can be very difficult. They will break down with infections and all those things. So the simple circumcision procedure could lead to a lifelong surgical procedure, sometimes 2 or 3 times procedure, before you can get the penis back. So it's not a very simple procedure as people think. You can maim a child. And
once you're amputated, that one day, there's no coming back from that.
Oh, yes. And you see, sometimes, even after the amputation, if you are rushed to hospital early and you preserve the tissue in a gauze and cutting. Yes, attach it. You can reattach it. But some people don't know. Once it happens, they get so scared. So they are staying away from the hospital. You can attach it. Just like you have to preserve the tissue well. If you get a gauze and an ice block pack, rush to the hospital, you can reattach it. All right? So we want to open up and let, especially some of these circumcisions are done by, non-doctors, nurses, but some people have training, right? But we are talking about those who don't have training at all. Yes, because they watch it on YouTube and they think they can do it. It's very bad.
So you see, traditionally, we, like you mentioned, the wanzams and all that. How does one determine, you know what, this is the right person I should go to? Or you recommend we come to the hospitals and then we do it?
Actually, the wanzams are very good at the circumcision. Some of them have been trained from generations. They've been passed on from their ancestors. And so, you know, surgical procedure is like apprenticeship. All right?
They train them.
So the wanzams are very good at it. All right? Though there are some few lousy ones, right? Yes. But there are people who are not wanzams, who have no medical training or health training, but they see somebody doing it, or they watch it on YouTube and all these things, and then they think like, oh, this is a cheap way of making money.
But Doc, are these like family members? Where do we find? Where do you get these? Where do you find these people?
Oh, these are people in the community. I mean, they are very bold and feel like
they come with this false confidence.
Yes, because they can feel, and especially those who have had little exposure or contact with healthcare. Some people have worked in a hospital situation before. They've seen people doing this before, or they have assistant nurses or doctors doing this before.
So in their mind,
they think it's a very easy procedure. They can do it.
Yeah.
All right.
Because
so that means they want it to be like their side business.
Yeah.
You understand? Without any proper training.
Yeah.
All right. And that is very dangerous.
Because speaking about it, bleeding was a top issue at 21.74% in the whole study. Yes. That was. What are some of the early signs of perhaps? We mentioned the fact that some of them, when they do with the excessive bleeding and all that, it's like, oh, he keeps reassuring them that everything's going to be okay. But what are some of the things people should look out for? To say, what, this is too much. I have to go to the hospital once and for all.
Yeah. Usually, when you do the circumcision, like I said, every surgery could be attended with complications. There's nothing like this is a minor surgery or this is a minor surgery.
Every surgery is a surgery.
Yes, every surgery is a surgery. From circumcision to even, heart transplant. So, as a doctor or a professional or whoever you do circumcision for, we advise that at least observe the child for about an hour. All right? Don't send the child right home. Observe the child for the bleeding. All right? And the bleeding should not be something significant. It should be something, minor. You understand? About a gauze or two should be fine. So you observe the child for about an hour. You are sure there's no bleeding. You understand? And sometimes too, the diaper, okay, sometimes after circumcision, the diaper can also be rubbing the edges of the wound and can also provoke bleeding. So it has to be loose as much as possible. Because initially, after the first few hours, there may not be bleeding. But afterwards, when the diaper keeps on rubbing,
it can open the wound again.
It's lodging the blood clots and all those things, and then the patient can start bleeding. So you also need to advise the patient. All right? And then you tell them, if they go home and they see that this bleeding is ongoing, they should quickly come to the hospital. But you don't keep on reassuring them that it will stop, and then they will bleed to death. That's very abhorrent, and that should not be allowed.
But the risk involved are quite many. You've mentioned amputation, we've mentioned the excessive bleeding.
Yes.
And then the
infection.
The infections as well.
Yes, you can have fistula formation.
That part I don't understand.
The fistula, when I say fistula, it means that you have an extra hole down there. So when the urine is coming, it will drop in that hole before it comes out from the tip itself.
Yeah.
Because you have strangulated the blood supply. Sometimes it can be a bite of the suture you are using. So it will go through the urethra, the pipe through which the urine is flowing, and it will create a hole. So you have two holes. That's why you call it a fistula.
Because you are usually familiar with the obstetric fistula. I didn't know for men to...
Yes, there's a penis one. Because urethral-cutaneous fistula. And sometimes these things can be very difficult to treat or heal.
So it's like when you say it can be difficult, that means there's a chance you can heal.
Yes. I mean, usually we have to repair it with surgery. Yes, usually we have to do surgery to repair it. And because the blood supply has been stripped, I mean, sometimes it can be very, very, very difficult to fix it. Yes.
Okay.
Yes.
Is there a chance perhaps, when we've mentioned excessive bleeding, but is there a chance perhaps you might be bleeding, but it's not showing outward, maybe it's internal? Or there's no chance of it?
No. I mean, the penis is a external organ.
Yeah.
So you will see it.
Yeah.
You will see the bleeding coming out.
Okay.
You will see the penis swelling.
Yeah.
So it will not be hidden.
Okay.
You understand? Yes. So that is why you have to be vigilant and watch out for the bleeding.
Okay.
You see, once you have your mind that these are the possible complications, then you look out for them.
Okay.
You understand? But because you assume that, this is a normal, minor, small surgery, you just, let it pass. Yeah. And unfortunately, if you don't take care, it could be complicated by this.
Yeah. So what about when it comes to the pain? Is there a chance perhaps if it goes beyond, how many days will you say typically the pain should be?
We even advise that before you do the circumcision, give the children some painkillers.
Okay.
Some people assume that children don't feel pain, or they are less of human beings.
But so the way they even cry when they are...
They even do the circumcision without giving them any pain relief or any anesthesia, which is bad. You understand? So you even have to give them the pain relief before the surgery, and then some after the surgery, about 2 or 3 days after the surgery. You understand? Some of them may be crying because of the pain. Some may be crying from other reasons. Yeah. But pain is very important. You take care of it. Because the child cannot communicate to you, you don't assume that the child, that the thing is not painful. Yeah. You understand? It's just that they're not able to communicate, but they're feeling pain. They're human beings as well.
But most of the time, I know for a lot of people, they do it when they are young. Perhaps they are babies and all. But what about the adults? I read a situation just before we had this conversation. I think it happened in South Africa, where the man had made an appointment with his lady, But he still went ahead in the morning to go and have the procedure, and he still went ahead to sleep with his lady in the evening, and it affected him adversely. Do you have cases like that here?
I haven't come across that case yet, but that would be a very risky.
You won't advise that?
No. It's very risky to do that.
Yeah.
You have undergone surgery.
Yes.
The wound is not healed yet. Why do you, try and attempt?
You are going through something painful, and then you want to...
Yes, so that's a very risky behavior.
Yeah.
And actually, most of the complications occur for babies with small penis.
Okay.
We call the micro penis. So usually when the penis is small, that's where we see a lot of these complications.
Oh, really?
Either the skin will be cut short, or be cut long, or the tip of the penis will be
hard
amputated.
to measure exactly how to cut it.
Yes.
Okay.
Yes. So that's why you need a training. Training programs. The same way in Konfanoche, Dr. Ahin, they organize training programs for nurses who are interested or health professionals who are interested in doing circumcision. It's very important. I myself, I was one of the trainees, went through the program. You understand? It's very important that you go through the training before you start circumcision. Don't take it as a simple operation or simple surgery, because
nothing's ever that simple, is
it? Yes.
It's like somebody can see us here and be like, oh, what this presentation, I can do it, and then we give you the baton.
Yes.
You find that
you remember the Shakespeare's play, Merchants of Venice?
Yes.
Yeah, Shylock borrowed some money to Antioch,
and
then the contract was that if you're not able to pay a pound of flesh,
yeah, exactly.
he didn't think that taking a pound of flesh would be associated with blood.
Yeah.
So when he was demanding that he wanted Antioch's pound of flesh, okay, right, go ahead and take the pound of flesh, but make sure you don't shed a drop of blood.
Because it wasn't part of the contract.
It wasn't part of the contract.
And she really did well with that.
Yes.
Yeah.
So the moral of the story here is that there's no way you can take a pound of flesh from somebody, or even an ounce of flesh from somebody without shedding the blood.
Yeah, that's true. But infections can escalate quickly. What are earlier you mentioned the fact that when you wear diapers, they can shape the wound and all that, and can even affect it adversely. What other ways can we help prevent infections from?
Yes, the infection is basically because most of the procedures are done under unhygienic conditions. All right, they are done at home. Some people are using blade, even use blades. They don't sterilize the instruments.
Really?
Oh yes, the gauze they are using are not sterilized. They buy gauze from the market or gauze cotton from the market and use it. So it's the procedure itself, the way it is done, is not done under sterile or hygienic conditions, and this is one of the causes of the infection.
Can we trace them and perhaps arrest them or something to serve as a deterrent from others? Bringing that false confidence that they can do it, and because they are hurting people.
Oh yes. It's a public health concern, and those of us in the field seeing these complications. Where I practice, I see complications about 1 or 2 every month. You understand? Yeah. So I think it's a public health concern. So that is why I decided to talk about these things, because it's one of the neglected surgical conditions, but it's maiming the kids, and so we need to bring people attention to it.
Yeah. So that, more attention can be drawn, and then we can focus on. Yes. But for some people, ideally, like 95% of men do it, but some people choose not to do it. But for those, for a few of them, can we say perhaps they have a pre-existing condition which doesn't allow them to be circumcised, or they have to go through some kind of pre-surgical or something in order for them, perhaps maybe they're anemic or something? Oh
yeah. There's a condition we call hypospadias. All right, hypospadias.
Okay.
All right, where the urethral opening is down below instead of being at the tip. So those people, we ask them to wait. We fix the hypospadias before circumcision. All right. There are some people who also have bleeding problems. If you perform the circumcision within the first week, they may bleed to death.
Okay.
So because of these bleeding issues, you may want to hold on until you sort out those bleeding issues before you undergo the circumcision. There are several reasons for delaying circumcision.
Yes. Dr. Davis, in about 30 seconds, I pray next week we may have to continue this conversation, but in about 30 seconds, because we really do not have time, we have to go for a round lottery. Give us your final words before you leave.
So my final word is that anybody who wants to learn circumcision should make sure that that person gets dedication and proper training before you attempt circumcision. Circumcision should not be taken as a minor or simple procedure. It could be attended with complications, even death.
Thank you. And I'm sorry to cut this conversation short on circumcision. And I want to thank you, Dr. Davis Bray. He's a urologist with the Tema General Hospital. And we'll be going for the round lottery. And after that, we have the social media corner and the sports update. We'll be back right after this.